Welcome back to the program. So let's talk about two things that could be medical breakthroughs. So we're going to spend some time on medical stuff for this segment. First is one of the worst killers out there, okay, and that is pancreatic cancer. Sadly, my father had it and surprisingly beat it. I mean, it's really unbelievable. There was this one technique, one surgery called the Whipple technique, and it had about a 25%, success rate. And my father had it. This is before he kind of lost his mind and had dementia and all that. But before that, he was dealing with pancreatic cancer. And it was not stage 3 or 4 or anything, but it was stage 1 or 2. I think it might have been 2. And the doctor said, look, there's this surgery that we can do, but it's only a 25% success rate. What do you want to do? So he opted to do it, hoping that he'd be part of the 25%. Well, guess what? He was. He was part of it. And not only did he have pancreatic, but he also had bile duct cancer as well. And so they did this operation on him, and they cleared it all out, and he was good to go. However, right afterwards, because of chemo and things like that, it really affected him cognitively, shall we say. And he died, a few years after that. But that was a side story. So there's a new drug, an unprecedented new drug that is showing incredible results for pancreatic cancer. The experimental drug is called daraxonrasib, if I'm pronouncing that correctly, which doubled survival time in patients with advanced pancreatic cancer and has also shown effectiveness for lung cancer, colon cancer, and ovarian cancer. Listen to this. Every single patient with advanced pancreatic cancer who walked into Dr. Weinberg's office told him that they would rather take an experimental medication than endure another round of chemotherapy. Weinberg, it's actually, co-director of UCLA's Health's GI Oncology program, was leading a clinical trial of a new drug called daraxonrasib. All the study participants previously had chemotherapy, and they were starting to fail. Statistically, I knew only half of them would get the pill, and we don't get to choose who they are, Weinberg said. I put a lot of patients on the chemo arm, and none of them are alive anymore. It's one of the most emotional studies that I've ever been a part of, he said. Enthusiasm around this drug is reaching a fever pitch. In the phase 3 trials of 500 patients, the drug was shown to double the survival time of patients with advanced pancreatic cancer, a notoriously deadly cancer, 13.2 months on average compared to 6.7 months for people who got chemotherapy. On Sunday, Weinberg and his colleagues presented those results to the American Society of Clinical Oncology at their annual meeting in Chicago. The full study was simultaneously published in the New England Journal of Medicine. When Revolution Medicines, which makes the drug, released the trial's preliminary findings in April, Dr. Rachna Shroff, chief of the Division of Hematology and Oncology at the University of Arizona's Cancer Center in Tucson, said, quote, she started crying tears of joy. It's that big of a game changer for those of us who treat pancreatic cancer, she said. It's absolutely unprecedented. Now the excitement is spilling over into other types of cancers. This same drug, which is taken as 3 pills once a day, works by targeting a mutation in the KRAS gene found across many cancers, including lung, colorectal, ovarian, endometrial, and a type of bile duct cancer called, I can't pronounce this, cholangiocarcinoma. Not sure. Pancreatic cancer may be the first for this drug, but there will be others, said Dr. Brian Wolpin, who also led research on this drug and directs the Hale Family Center for Pancreatic Cancer Research at Dana-Farber Cancer Institute. Now the floodgates have opened. Dana-Farber. Huh. Let me think about that for a second. Wasn't Superman Christopher Reeve's wife Dana Reeves? And I thought that she had and died from pancreatic cancer. Farber is obviously a very interesting last name because of Barry Farber, who I was extremely close with. But I don't believe that he had pancreatic cancer. I think he just died of, being old age and things like that. So I don't know where the names from the Dana-Farber Cancer Institute come from, but I do know both those names. The Food and Drug Administration has already put the drug on a fast track towards approval for pancreatic cancer, and earlier this month said that it would permit Revolution Medicines to give it to patients outside of clinical trials in an expanded access program. Dr. Mark Goldsmith, Chief Executive Officer for Revolutionary Medicines, declined to provide a timeline for when the company will file for an FDA approval. Our professionals are still working literally 24/7 to get this material prepared as quickly as possible, he said. Shrinking tumors. Most pancreatic cancers are diagnosed in later stages of the disease when surgery really isn't an option. Even with our best chemotherapies, the average benefit and life expectancy is around 6 months, sometimes as little as weeks or even just a few months, said Dr. Samik Rawacharjari, a gastrointestinal medical oncologist at the Ohio State University Comprehensive Cancer Center. It's barely enough time for families to even grasp the situation. Just 3% of patients diagnosed with metastatic pancreatic cancer are alive 5 years later, according to the American Cancer Society. Debbie Orcutt, 71, was diagnosed with stage 4 pancreatic cancer. In April of 2024, the cancer had already spread to her liver. Prior to her diagnosis, her only symptom had been a nagging pain in her lower left abdomen that got worse at night. When chemotherapy started failing Orcutt, she enrolled in the clinical trial for this drug and was one of the participants who actually got the drug. Since she began taking the pill in January of 2025, the spot on her liver had completely vanished, and the tumor on her pancreas had shrunk by 80%, according to her own oncologist at Dana-Farber. I feel great every single day, said Orcutt of Spencer, Massachusetts. I do not dwell on the fact that I have pancreatic cancer. Neither Chowdhury or Shroff was involved with the clinical trials of this drug, but both have already begun curating lists of patients to get the drugs once it's available. There's not a doubt in my mind that the second it becomes available, it will be starting to be used everywhere and for all different types of cancers. So that's pretty interesting because, again, that is one of the worst ones that you could possibly get, okay? Really, really bad. Now, here's another one. This one affects men. Thankfully, this is one that is one of the least deadliest and slowest growth, but it's prostate cancer. And, as we get older as men, well, things change, shall we say. I have been screened. I have had a painful cystoscopy. I was on Flomax for maybe I took 1 pill, 2 pills, and I had such a bad reaction to it. It was a horrible reaction. My whole body was hot. I had a headache. My mouth felt dry. My stomach hurt. And I took like 2 pills. And I said, these side effects from this big pharma bullshit drug were so bad that I opted instead to have the cystoscopy, which was by far, and I've had kidney stones in the past, and that's really painful. This was so painful. Thank God it was only like 40 or 45 seconds, but it was 40 to 45 seconds of fucking hell. That's all I can say. I don't wish it on anyone, okay? It was bad. Anyway, getting back, not on the personal stuff, but on what we're talking about. Another experimental treatment is killing prostate cancer tumors while reawakening anti-tumor immunity. Prostate-targeted engineered nanoparticles made of amorphous silica are effective in killing prostate tumors directly while enhancing anti-tumor immunity, according to a preclinical study led by investigators at the Weill Cornell Medicine and the Cornell Duffield College of Engineering. The particles derived from silicon dioxide, a common component of healthy foods, or fossilized sedimentary structures from single-cell organisms, induced several complete remissions of aggressive tumors in mouse models, supporting the further investigation of their use in clinical trials on humans. Originally developed for medical imaging applications, these particles, known as ultra-small fluorescent core shell silica nanoparticles, or Cornell prime dots, have progressed into advanced phase clinical trials for image-guided surgery and therapeutic applications. In recent years, the researchers have found that the C dots on their own can exert therapeutic effects against cancerous cells while sparing the healthy ones. In a new study published on June 15th, so this is pretty recent, in Cancer Research, a journal of the American Association for Cancer Research, the researchers evaluated the particles' effects on mice and the models of aggressive prostate cancer. They showed that the particles made the tumor cells highly susceptible to a powerful self-destruction process and simultaneously convert the normally inactive cold prostate tumor immune microenvironment into a, quote, hot environment, one featuring strong anti-tumor immune activity, which can dramatically enhance the effects of other immunotherapies. Quote, we're very encouraged by these results. A treatment that directly induces tumor cell death while transforming the immune microenvironment, as this does, would represent a brand new clinical paradigm, said study author Dr. Michelle Bradbury, the endowed professor of image research and radiology and director of the Molecular Imaging Innovations Institute at Cornell Medicine and a neuroradiologist at New York Presbyterian Medical Center. The study was part of a long-term collaboration between Bradbury's laboratory and the laboratory of co-corresponding author Ulrich Wiesner, the Spencer T. Olin Professor in the Department of Material Science and Engineering and a professor in the Department of Design Tech in the College of Architecture, Art, and Planning. It was funded in part by the Parker Institute for Cancer Immunotherapy at Cornell University. As detailed in the study, the usual effects of these C dots include pushing prostate tumor cells towards a self-destruction mode called ferroptosis, in which the overwhelming oxidation of molecules in the cells, especially the far-related molecules that make up cell membranes, leads to the degradation of those membranes. Precisely how the particles trigger ferroptosis remains unclear, but the researchers have found evidence that the particles themselves, originally designed as carriers for imaging and different agents, often pick up positively charged iron ions in the bloodstream, then transport those reactive cargoes inside tumor cells, where they ultimately can help catalyze runaway oxidation. There's a lot of interesting big words in this one. Almost done. The C dots have numerous immunological impacts, including the conversion of T cells, macrophages, and other immune cells in the tumor vicinity from inert or actively immunosuppressive modes to robust anti-tumor activity. These results led to C dots sensitizing tumors to clinically approved anti-cancer immunotherapies. The experiments also revealed extensive growth inhibiting metabolic disruptions in different cell populations within the tumor microenvironment. The silica particles were specifically targeted for prostate tumor cells by a molecule that hones in on the prostate cell surface protein called PSMA. But even in non-prostate tissues where the particles were briefly concentrated, such as the spleen, for instance, there was no sign of toxicity. Quote, "It seems unreal. How is it even possible that rather than a single pathway, we see all these effects happening simultaneously and only in tumors and not in healthy tissues," Wiesner said. "I have to wonder whether ultra-small silica, very early and ubiquitous presence in the environment in foods like leafy greens or cereal grains has given it a connection to biology that we're only now beginning to figure out." So there you go. They say somewhere around 70+% of men at some point in their life will more than likely have prostate cancer. So knowing that, there's cures out there or things that are looking promising, I'm sure the men in the audience are going to be like, hey, that's really good. So I wanted to bring two of these things because, again, cancer is a horrific thing. It doesn't matter how healthy you are. It doesn't matter how you exercise and how you eat right. I mean, obviously there are things that you can take that can prevent, you from getting sick in general. But a lot of it's hereditary too. A lot of it's genetics, right? But you want to have a lot of antioxidants, obviously, fish oils, things like that. And you just want to avoid all the inflammatories, right? Stay away from the seed oils. Don't eat anything bioengineered ever. If you're going to have sugar, try to have cane sugar, not high fructose. Stay away from soy lecithin. Stay away from monosodium glutamate. Stay away from, I could go on and on and on. But the bottom line is there are things, and it seems, at least at this point, there are some promising new technologies and treatments out there for people. And so I just wanted to bring that to all of your attention. Those are my thoughts. What are yours? Put them down in the comments below. We'll see you in the next one.